Well, joining us right now is our weekly political panel, Susan Smith, Principal with Blue Sky Strategy Group, Tim Powers, Chair of SUMA Strategies, and Anne McGrath, Principal Secretary to the NDP leader, Jagmeet Singh. Nice to see the three of you.
Nice to see you, Michael.
Well, perhaps not surprising, I'm going to begin with you, Anne, given the deal that was announced today. But, you know, here we have, as expected, the two classes of medication being covered with a promise to do more. Are you disappointed that at the end of the day, this was not a wider deal that covered more, that instead of promising public pharmacare down the road, that it was more immediate?
So I am always disappointed that we don't get everything, for those who know me. But what I will say is that we were supposed to just come up with a legislative framework. That was what was agreed to, that was the legislative framework. But because we didn't reach an agreement by the end of December, which was the timeline in it, we agreed to extend it to tomorrow as the deadline. And in order to do that, one of the things we did was we upped the ante. We decided we were also going to try and get some classes of drugs in there. Obviously, I would like more classes of drugs, but this is more than was actually in the supply and confidence agreement.
Mm-hmm. So more than the supply and confidence agreement. But, you know, let's stick on drugs for a second here, and I'm going to get you in here, Susan, because
pass them around.
well, I'm not paying for them. Okay. But anyways, but you know, of course, the Liberals campaigned on pharmacare in the last election, as did the NDP. But when you look at this, I'm kind of wondering if it is enough to satisfy voters who did turn to the Liberals over this one policy platform. Because if you compare it, for example, to the number of drugs that were covered under another Liberal government, Kathleen Wynne of Ontario with her pharmacare program, that was far more, thousands more of drugs than what we're seeing here.
I think you have to look at the big picture on it, Michael. In the time between when the Liberals were elected in 2015 and now, we've had a pandemic. Out of the pandemic, and well, before and then out of the pandemic, we had the Canada Child Benefit. We have a national child care agreement. We have a national dental care plan. And now we have the framework for our pharmacare program and the proof of concept, the chance to see how we can do it and what's the best way to do it. So I think it's a responsible approach. It's the Liberals can say, they can point to very hard work that they've done to deliver things for Canadians to make things more affordable, and included taking a huge step in terms of a national pharmacare program. We've never had one before. The Liberals have to be responsible with the dollars that we do have. As a country, they have to manage the fiscal coffers too. So I think this is a good first step, a responsible first step, and it's also important to look at it in the context of all the other things they've helped to provide Canadians with in the next over the past few years, and that they have going forward.
Mm-hmm. Tim, what do you think? Do you think people will be disappointed, satisfied here?
I think time will tell on that. I mean, certainly congratulations to Anne and the NDP. Getting more than they wanted is a good thing for them. I think the challenge for the deal perhaps is not what's in it, but the primary messenger, not Mr. Singh, but Mr. Trudeau. I mean, look, it's not a partisan comment to say right now, if you look at the polls, he's not very popular. His government's not very popular. So will Canadians accept by whatever the Prime Minister is selling, though some of it will be legislatively entrenched? What happens should he not become Prime Minister and all of that? I kind of wonder, is this a bit like Liberal daycare at the end of the Martin regime when Mr. Dryden came forward with it, and they'd hoped they'd get a deal? We'll see. I think ultimately, though, people will judge whether this is a good program or not by how quickly they're able to access the medicine, the drugs that they need, and whether it truly will be non-prohibitive to them or have limited cost.
Well, you know, I do wonder about the timeline here, though, because when you look at it, yes, immediately you're going to be covering these two comprehensive drugs. However, there's also going to be an advisory body that will be struck to determine how a pharmacare program, national pharmacare program, could be paid for and rolled out. Essentially, it looks like it's kicking pharmacare once again down the road, and we're only, about a year away from another election.
Well, first of all, there was not agreement at the end of December or even into like a week or so ago about the model to use, right? So we were very, very insistent that it had to be single payer, like the Canada Health Act says, and so we wanted to make sure that it was being delivered in a way, the same way that our other parts of our healthcare system are delivered. The Liberals did not necessarily want that, and that was a real sticking point. So I think that what the expert panel is going to do is look at the what Minister Holland refers to as the proof of concept, right? So we have the 2 classes of drugs that are being delivered through a single payer system, and then this expert panel will be looking at that and the financing. The other thing I want to say about that is there have been so many crazy numbers thrown around about this program. I hear $1.5 billion, I hear $6 billion, I hear $40 billion. I've heard as high as $60 billion. But all of the reports and reviews that have been done have indicated that there are significant cost savings in addition to the positive health outcomes. And so I think that the expert panel will be looking at how are these 2 classes being delivered, and how does that apply to the rest of the work that we have to do once we get the Canadian Drug Agency to develop the formulary of essential drugs.
Mm-hmm. Does that get to your concern, Tim, about the former Minister Dryden with his own program?
Again, I think costs are obviously very important, and people are going to want to pay attention to that. Also, the uptake. We've seen provinces initially say, no, we're not going to touch it. Some say, let's see the details. I mean, there will be a requirement for provincial buy, and that probably the nature of the dynamic didn't allow for negotiations. Anne had enough to negotiate, never mind negotiating with 10 provinces, but that's important in this. As we saw with childcare and daycare, the provinces eventually had to come on board, and all of them have, I think. So we'll see where they are. And there are some provinces, and Anne knows this, Susan knows this, who want to see spending in other areas first, would rather take the money and allocate it that way. That's going to be part and parcel of this exercise. That's why I say that's not going to fall to Mr. Singh. That's going to fall to Mr. Trudeau and or his government, which at the moment doesn't have the currency it did when it brought in daycare.
I think what will be important, I agree with Tim in terms of the timing and things. It'll be interesting to see how the Conservatives respond to this, because this is a multi-stage process. Mm-hmm. The legislation has been introduced today. It's got to go through the House, and it's got to get passed. Then negotiations have to happen with the provinces, and then the implementation of this proof of concept model is put into place. I think it's a responsible approach in the sense that we know, and I said on the show last week, though I had the number wrong, I said that I work for a coalition of companies that do the benefits administration in the country. And 97% of Canadians have some kind of drug coverage. But this is a good way to test. It's through their employers or through other programs. I think this is a good way to test if this is the best way to get medication out for Canadians. I think this is a good choice of medications to use. That 9 million women, they said, eligible. Nearly 4 million people are diabetics, and there's implications on the healthcare system when people don't take the medication that they need for their health situation. So it's going to take time. But Mr. Poilievre walked away from the microphone when asked a question, not a complicated question, but he walked away. And it remains to be seen how his party's going to react to this, and what kind of noise and what kind of hay they're going to make over something that can help Canadians.
Okay.
Well, and there are provinces that are anxious to get going on this. That's the other thing. There are some that are saying that they don't want any part of it, but they often say that, and did say that around childcare as well. So I think that there will be provinces that will kind of jump on board fairly quickly, and then I think other provinces will come in, and that is how Medicare was developed in this country.
Okay. Well, that is our time. Thank you for this. But very quick question, very quick answer. Do you get to rest now?
I hope so.
Well, well-deserved rest if you get at least a couple of days. And Susan, Tim, thank you for the time.
Thank you.